Good afternoon, and thank you for joining us here at Combined Arms. We are excited to have a guest on for our Facebook Live today. We would like to introduce our guest, and our guest is coming to us from the Women Veteran Center at Michael E. DeBakey Medical Center. If you'd like to introduce yourself, we're happy to have you.
Sure, I'd be happy to. My name is Dr. Rula El-Sarat, and I've had the privilege of serving as the medical director of the Women Veterans Health Program at the Michael E. DeBakey VA Medical Center in Houston for over 16 years now.
Awesome. Thank you so much for joining us today. And we're very happy to have you in regards to this incredible program that's at Michael E. DeBakey. Can you tell us how this particular clinic came about, and what are some of the services that are specific to women veterans that y'all offer here at the VA?
Sure, I'd be happy to. It's actually been it's a wonderful story that I'm very proud of. I started off in 2004 where we had really minimal services for our female veterans, and was able to grow this program to really an outstanding, very comprehensive program as we've seen the number of female veterans increase over the last 15 years. We basically have expanded our services in the last 15 years significantly. We have improved the quality of our services, and we have really tried to focus on improving our female veteran patient experience while they're here at the VA. And so some of the services that we have managed to develop over the last 15 years, I think one of our shining stars here at our facility, we went from being in this tiny little clinic that was kind of hidden in the middle of a surgical unit to now this big, beautiful, about 9,000 square foot women's health center that is located at the front of our hospital with a big sign, very welcoming. It has a private entrance for our female veterans who are uncomfortable coming through, the main entrance, which can be very crowded and have a lot of male veterans. And in that health center, we provide comprehensive health services that are very specifically geared and unique to our female veteran needs. So we have an integrative model. So we offer primary care services, and they are very comprehensive. So that means you can get your women health issues taken care of there, as well as just general primary care management. We also have mental health co-located with us, so you can see mental health providers. And our mental health providers are not just any providers. We have a psychologist, for example, who's trained specifically in female veteran mental health and female veteran mental health issues. In addition to that, we have maternity care coordination services located in our Women's Health Center. And we have another shining star is our breast care, comprehensive breast care service. We have mammography and comprehensive breast care services offered within our health center. And it is state of the art. We offer the 3D mammography, which is the newest and latest technology offered to all of our veterans. We have a breast care radiologist who is really superb. And we can do a lot of really neat things for our female veterans. When I say integrated, I mean it's truly integrated. If I'm seeing a patient, for example, in my primary care clinic, and she hasn't had her mammogram or is overdue, or let's say she lives really far away, I can actually ask our breast radiologist to fit her in that day and get her mammogram, for example. Or if she needs to see someone from mental health today, we can provide same-day access as well. And our breast care radiologist also offers something very specific and unique, which is very difficult to find in the community, which is, for example, she'll do a screening mammogram. If it's abnormal, she will offer that patient to do the follow-up testing, the diagnostic and the ultrasound on the same day, and make sure that veteran is scheduled very quickly to be seen, for a biopsy or any other further additional services. And then we have a pharmacist who can do management of chronic conditions like diabetes and hypertension located in our clinic as well. All in all, it's just a very welcoming center for our female veterans where they can get very, let's just say, accessible and coordinated care in a timely manner that's very, very specific to their needs. In addition to that, we have the medical center offers full gynecological services. We have 2 full-time gynecologists here that are located in our facility. They offer state-of-the-art services in terms of surgery and medical treatment for gynecological conditions. We have very unique mental health services that are really specifically geared towards our female veterans. They include an eating disorder program. We have this fantastic WISER program, which is really one of a kind in the nation and in the world, which is an inpatient elective program for women who are suffering with trauma, history of post-traumatic stress disorder from sexual trauma. And that is a program that's geared on teaching women, empowering them with tools and skills to manage their PTSD and their related issues. And we also have maternity care coordination services. Specifically, we're focusing now, for example, on reproductive mental health and helping women with their postpartum depressions or issues that they're facing related to their mental health during pregnancy. I mentioned our breast health care, which is very comprehensive. And we also have some specific programs that involve a lot of our female veterans. For example, we have a great diverse population of female veterans in our facility. We have a large number of LGBT veterans. We have an LGBT coordinator and program. So there's really, and I can go on, but I'll stop there. But we really have been working hard on trying to expand these services and really ensure that there are high quality services for our female veterans.
Thank you, Dr. Elsterag. Those are really, really amazing services that you offer as a woman veteran. I appreciate all that you do. Is there a particular age range or any particular demographic that you see more of in the Women Veterans Clinic?
Well, I mean, one of the things that I love about working with female veterans, and I will say that I am here because of women veterans. I mean, I've been here for 16 years. And as you can imagine, trying to, bring about this change, we've been working on culture change and improving services. It hasn't been easy, but we've been very successful. And female veterans are just amazing individuals. I mean, they've really sacrificed so much for our country and for our freedom. And we see the effects or the fruits of that sacrifice every day here. And it's just rewarding. They are resilient. It's humbling. And one of the things I love is just the great diversity of patients that we see. So the average age of our female veterans here in the medical center is 38 to 40 years of age. That population is very different than our male veterans. And I think this is where, having our female veterans health program is essential, because we need to acknowledge that population is different than our male veterans, and we need to recognize what are their specific unique needs to ensure that we meet them. So we have female veterans. I mean, my oldest living patient up until a few years had been 101 years of age, and my youngest is probably about 19. So we really see the full breadth of age ranges. We also have higher diversity in our female veteran population than in our male. Up to 40% of our patients are of either African American or Hispanic origin. And then we have a combination of women from rural backgrounds and some from more urban backgrounds. So it's just wonderful just to see, all the different backgrounds and age ranges that we see in our patient population. Did I answer your question completely? I am not able to hear you.
Are you able to hear me now?
Yes, I'm not sure what happened.
My apologies, technical difficulties.
No problem.
One of the bigger questions that I have, and I'm sure a lot of the folks listening would like to hear, is that how would one go about registering in the Women Veterans Clinic or the Women Veterans Program, and why the Women Veterans Program as opposed to staying with a regular primary care physician in one of the other clinics?
So basically what I'm talking about today is really not to exclude any of the other primary care clinics. I am the director of the entire program. So actually, I'm responsible for all health care that women veterans receive all over the medical facility. That includes everything like surgical services and, subspecialties of medicine, the care that they receive in the C-box. So when I say we offer comprehensive primary care services, what I mean to say is, in addition to the Women's Health Center, we have designated women's health primary care providers located in our general primary care clinic here in the facility, and also in all of the community clinics that are located throughout the greater Houston area. And all of those providers are also women's health designated providers. And I'm actually responsible for ensuring that those providers can meet the criteria to be able to take care of female veterans in an appropriate manner and to be very well equipped to do so. So I think the decision, I think the decision is really a personal decision for each individual. Some women want to be located close to their clinic, and that's understandable. Like I said, our average age is young. Our women are busy, they work, they have children. So if it's more convenient for them to go to a nearby CBOC, then that would probably be their best choice. But then we do have women who live far away who choose to come to the Women's Health Center because they really like the privacy of being in a women's health center with its own entrance and having all those really specific services all in one area. And then there are women who do just fine obtaining primary care services in our general primary care clinic. So I would just advise women to, kind of think about what they think would fit them best. And if they are not, if they feel that whomever they've signed up for or who they've been receiving care for is not a right fit for them, they can always choose to go to any one of the other options.
Thank you for sharing that information.
So anyways, yes, and let me explain how to go about enrolling. So we have the VA main number, which is 713-791-1414. And you would call that number and ask for the eligibility office. At that point, you can enroll for services. And they will assist you in assigning you to a primary care provider. I do also want to point out that, we are in difficult times right now. There are a lot of veterans struggling with financial hardships. Some of you may have lost your jobs. Some of you may have taken significant pay cuts. And whereas you may have previously not been eligible, you may currently be eligible. So I encourage you to call and ask. We do have a hardship waiver form that can be filled out, and you may be able to receive care here. Essentially, we are trying to help as many veterans as we possibly can, and to provide excellent mental health and general medical care for our community of veterans.
That was some incredibly useful information. I don't know that a lot of folks realize that that even women being seen in the other clinics are under the care of your program. So thank you for sharing that, as well as the information about the hardship. I think that's really, really valuable. And certainly we want to get that out to the community. We're really, really pleased to have you on and share information about this special program here at the Houston VA. And we'd like to ask you if there's anything else that you'd like to share about the program that perhaps maybe folks didn't know. I think you're sharing a lot of really new information and useful information today.
So I think there are several things. First of all, one of the things that a lot of our female veterans do not know is our maternity care program. If you are eligible, if you are a veteran, you are eligible for maternity care coordination here at the VA. And what that means is the VA will actually help you coordinate obstetric care in the community and pay for that care during your pregnancy. And that includes paying for the infant in the first week of life as well. And that includes the full range of care that is required for each veteran. So if it's a high-risk pregnancy and they require additional, services to manage their pregnancy, the VA will actually cover that. Our maternity care coordinator is a full-time position. She's an RN. Her name's Marlene Cano, and she touches base with our pregnant veterans every 2 months. She's accessible to all of them. Will help coordinate services that even include things like lactation classes and birthing classes. And we will provide equipment like breast pumps, and so on and so forth. So a lot of our female veterans don't know that, and once they find out, they come and they enroll for services here. And so we're happy to have those that group of veterans, including offering them, primary care services and everything else that we offer here. And I also do want to send the message that, there's been, I mean, when I said we were working on culture change, there's been this myth over the last, probably forever about the VA not being a place for women. And that's something that we've been working on so hard in the last, 15 to 20 years. It is one of the biggest goals of our institution. Our leadership is on board for it. We would never have been able to make all the changes we've made without that support. So I just want to send out the message that, that is not true, that we are a great place for our female veterans to seek care. I would argue actually that we're better than anywhere else because we exclusively take care of female veterans. We understand female veterans. We know, what their issues are. We are at the forefront of research in women veterans health. The VA conducts, the greatest amount and highest quality research in women veterans health. And we can do so in an integrated manner. So for those of you who have heard, one horror story or one negative story over the other, I invite you to really come and try us out, because I know on a daily basis, the feedback that I get from my patients, and we do focus groups here. We do a lot of good for a lot of female veterans, and I hear that every day, and that's what keeps me here. So I would, and you're doing a disservice. We're doing a disservice to our veterans, our female veterans, because they need this care. If we are kind of dispelling negative myths. So please come and try us out. We're here for you, and I think we can help you.
I'd like to say thank you because I actually was a recipient of the OB care that was referred outside, and I have a 5-year-old, so I was able to receive care outside of the VA in the med center, and also for the first week of my son's life. So I want to thank you for all the hard work that you've done. I'm a testament to your program. And also, we recently celebrated Women Veterans Day, and we're always welcome in the clinic there to share about women veterans. And last year we had a great display in the clinic there. So I just want to thank you as a woman veteran, and Combined Arms is very grateful that you're one of our partners. So thank you for joining us today. And if there's anything that you'd like to add or share with us as we close this out, please feel free to share any contact information that you have, and come back and join us again to share updates with your program.
Will do. Thank you so much for having me, and I look forward to hopefully seeing a lot of new female veterans as a result of this interview.
Thank you so much, and we hope that you have a wonderful afternoon, and we wish that you all will be well in these uncertain times. And if you have any questions, please feel free to go to the Combined Arms website or visit www.va.gov, and or ask your primary care provider for information about the Women Veterans Clinic.
Yes, and I know since you mentioned difficult times, we specifically are very COVID prepared. And I know a lot of women are having issues with obtaining mental health services. And we are ready and available for those of you who are struggling being at home. I know trying to manage a job, take care of children, deal with all of this COVID related stress. And so we offer 24-hour mental health services that can be done by video and telephone and even email. So for those of you who are struggling, please reach out to us. We're here for you, and we'd love to help you.
Thank you so much. We also have at our website, you can register for assistance if need be. You can message us privately on Combined Arms Facebook page if you need assistance, and we'll get you set up with a referral to the women's clinic or for mental health services as well. So we are grateful for guests like you that come on and share your resources. There's so many resources out there for veterans, and we want to just be able to provide direct access and information to our community. So thank you so much. And we look forward to talking to you again. Hopefully I'll run into you in the women's clinic.
All right. Take care. Bye-bye. Be safe.